present. So like I said in the beginning, today's lecture is based on stress management, so how we manage our stress. So here is an overview of what we will be discussing this evening. First, we will speak about what stress is. We will then speak about the different types of stress. Then we'll move on to the stress process and how our body reacts to stress. What are the effects of stress on us? And also some ways to manage our stress. We will then end off with some question time. So first off, what is stress? Stress is the body's automatic response to any physical or mental demand that it is placed on it. The adrenaline, that is the chemical naturally produced hormone that our body uses as a response to stress. When we go under stress, a fight or flight response is elicited. This will be discussed a little bit later. We know that stress is an everyday event. All of us deal with stress in different ways. Stress happens when any circumstance in our life appears that threatens or perceives to threaten our well-being. This also affects our ability to cope with it. Research has discovered that there's different types of stress. There is major stress versus minor stress, which is more routine hassles as what they are called. These can be things like moving, changing your household responsibilities, or our everyday hassles that we go through. All of these can therefore add up and become a major stress when a lot of things happen all after the other. Another type of major stress is something like a divorce or a big disaster that happens in our life. The cumulative nature of stress. This is when it adds onto each other. The experience of feeling stress depends largely on our cognitive process. This is things like going on a new date, terrifying others, or being with different types of people. People's appraisal of events are very subjective, and they're also influenced by the event that they are dealing with and the response that they have to it. There are 4 major types of stresses that research has shown. The first one is called frustration. This occurs in any situation in which the pursuit of some goal is thwarted or blocked. So an example of this is when we are in traffic. That stresses us out because we aren't able to get to our end goal because we are being blocked off. The second one is called, conflict. This occurs when there are 2 or more incompatible motivations or behavioral impulses that are competing for expression. There are 3 types of them. The first one is called approach. This is when a person has a choice between 2 attractive goals to them. So for example, your partner says to you, where would you like to go eat dinner? Would you like to go to an Italian restaurant, or would you like to go to a Chinese restaurant? You like both types of food. So the stress is choosing something where both results are going to be attractive to you. The second one is called approach avoidance. This is when a person has a choice between 2 unattractive goals. So avoidance. So for example, when you have work and you have to do 2 things that are not very attractive to you. Do you want to complete an assignment for 40 pages, or do you want to give a presentation? Both of them to you are unattractive. And the last one is called approach avoidance. This has happened when one thing is very satisfying to you, but the other thing is unattractive to you, but you have to choose between one or the other. If the result of them, it kind of helps you to go back and forth. This is when you're not actually too sure. Then the third one is our life changes. These are noticeable alterations in your living circumstances that require adjustments. So there's this model, it's called the Social Readjustment Rating Scale. This is used to measure life's change as a form of stress. You get higher points for the more stressful something is and lower the points for the less stressful something is. So for someone, moving is a very stressful event, so that'll add on a lot of type of points in their life. Another example is someone, changing jobs. That could be very stressful. Another idea is getting a new car. So yes, it may be stressful, but not as stressful for the other example. So depending on how many points on the scale these activities get. The last one is called pressure, and this involves expectations or demands that one would behave in a certain way. So the pressure to perform or to comply. So this happens a lot, especially when we're at work or when we're studying. We have to conform to certain norms while we're studying or while we're at work. We have to follow certain rules, and also we feel like we're under pressure in order to comply or even to succeed in those rules. So this is an overview of the stress process. So first we will have a potentially stressful objective event. So things like an exam, a date, a trouble with your boss, a financial setback, and these all lead to frustration, conflict, change, or pressure. So this is when we have this potentially stressful event. The next step is the subjective cognitive appraisal. So this is your personalized perception of the threat. So this is very influenced by you as a person. So are you familiar with this event? Have you gone through it before? Is it controllable? Is it predictable? And those sort of things. So first you get the event that happens, then you see how you as a person are going to have an approach and appraise to that actual stress. Our body reacts three ways in our stress. So there's an emotional response, a physiological response, and a behavioral response. So emotional response is all our emotions like annoyance, anger, anxiety, fear, detection, or grief. A physiological response, so that's our body responses. So our autonomic arousal, how our hormones are fluctuating, are there any neurochemical changes in our brain? And the last one are our behavioral change. So how does our behavior change? What are our coping efforts? Are we lashing out? Are we blaming others? Or are we seeking help? Are we solving the problem? How are we releasing our emotions? So we're going to go a little bit further into these three responses. First, we're going to speak to responding to it emotionally. So behaviorally, people respond to stress on all different types of ways. So we know with our loved ones and also with ourselves, how do we respond to our stress? Are we getting annoyed and anger and rage? Are we kind of becoming apprehensive with anxiety and fear and retracting and isolating? Are we filled with dejection or sadness and grief? Or do we have positive emotions? These are usually the four topics of how we would respond to our stress. Coping refers to the active effort to master, reduce, or tolerate the demands created by stress. These may involve giving up and blaming ourselves. It also may involve striking up at ourselves or also at others. It also could result in some self-indulgence, so eating, drinking, smoking, shopping, a lot of drug taking and unhealthy habits often happens in this area. Having a defensive coping mechanism, also this could result in a constructive coping, and that we'll deal with later of what are some constructive ways to cope. Our emotional response and performance is known as the inverted U hypothesis, because as one thing changes, as one thing decreases, another thing increases. So we're not really too sure how our body reacts to it, but everybody's going to react to it differently. Next, we have a physiological response of our bodies on stress. So there is different types of studies that are based on this, and a man named Roy Baumeister, his work shows that people under pressure, they feel self-conscious. And when they feel self-conscious, this often leads to a lot of distractive of attention, and also it causes choking under pressure. So if we think of maybe when we were at university studying, we would study a lot and we would get a lot of pressure on us. And as soon as we have to write the exam, all of a sudden we forget what's happening. We forget what we were studying. We have to go do a presentation, we prepared to it, but we choke under pressure and we aren't able to handle it. That's exactly what this study was showing. So I just want to make sure we're on our right page. So the physiological effects of our stress, this is our fight or flight response. So a man named Walter Cannon, he created the fight or flight response. This is our reaction to threats where our autonomic nervous system, so our ANS system, this is when we mobilize our organisms for attacking or for fleeing. So if you think when you're in a stressful situation, if you're being robbed or your life is at risk, a lot of people react differently. Your heart starts beating, your blood starts pumping a lot of blood, your heart starts pumping a lot of blood into your muscles, so you're able to run away. So your body starts creating this environment where it's able to fight and flight away from the situation. The fight or flight response is also very adaptive. However, modern stresses can often have a long-term effect on the body. So there were studies that showed all these chronic stresses and how long they were going to affect the body and what were the results on them. So what happened was there was this man named Hans Selye, and what he did was he used an animal model. So he would expose these animals to both the physical and to psychological stresses. And this created their response to them. So their reaction, how they reacted to stress. So he found that there were 3 stages. There was the alarm stage, the resistance stage, and the exhaustion stage. So the alarm stage, this occurs when an organism recognizes that there is a threat and they need to mobilize their resources. So therefore, they will essentially enter into this fight or flight response. Then the next is called the resistance stage. This occurs when the stress is very prolonged. This is a period when there is a physiological arousal, it has stabilized, but it is still above the baseline. So the organism copes with the stressor, but it's still a little bit above the baseline. And lastly, we have our exhaustion stage. This is when the body's resources are all depleted, and the research found that happens lots of times when a disease starts coming along into your body. So these are the 3 type of ways that we deal with things. We first have the alarm to it. How do we react? Our resistance, are we able to kind of resist the stress that's happening in our life and still continue and not let it fully bring us down? Or do we have the exhaustion phase where we are completely pulled down by it? Lastly, we have our behavioral response. So this is how we behave with the stress that comes into our life. So we have frustration and aggression, like we were speaking earlier. Do we become catharsis and quiet? Do we have our defense mechanisms? Or do we use our coping mechanisms that we were speaking about earlier, the definition of coping? Are we able to confront our problems? Do we start using humor? Are we expressing our emotions and maybe trying to seek help? Or are we using hostility? So when it comes to the behavioral problems, this is often something that we can see in our loved ones, especially when they come home. So coming home and being discharged is a very stressful situation because they're being in an environment that they're used to using. This is when there's a lot of their triggers in their life. So they're filled with all these stresses. So now behaviorally, what are they doing with these stresses? Are they seeking help? Are they continuing with their sponsor or with their counselor? Are they coming to you and saying, I'm needing a little bit of help. This is really stressing me out. What is their behavior? Are they going back into the behavior that they were when it was using drugs, manipulating, lying, deceit, and all those sort of behaviors? How are we responding to our stress? So now we will speak about the effects of stress on our body. So the first one is our behavioral and our physiological stress. So there was a man, again, like we were saying, his name was Roy Baumeister, and his work showed that we will perform under pressure. But are we being impaired by our task performance? Are we having a burnout? So are we using all our energy in the beginning? And like we were saying earlier, we're choking under pressure. What is happening? How are we able to have endurance? Are we able to sustain our performance? So chronic stress may contribute to many types of physiological problems as well as mental disorders. And we did a lecture a few weeks ago, whoever was there, I did a lecture on sleep. And stress is a big impact on our sleep. Are we staying up at night and stressing over things that are in our day? And that's impacting the amount of stress that we having. Are we avoiding things because we are stressed? How are we reacting behaviorally to our stresses? So from a physiological and psychology perspective, the effects of stress often are not always negative. There's also positive effects. So research has shown that stress can actually promote personal growth or also some self-improvement. Stress forces people to develop new skills, to also reevaluate their priorities, to learn new insights, and also to acquire new skills. If we conquer and we succeed in stressful challenges, it will also lead to improving our coping abilities as well as increasing our self-esteem. So a lot of times there is a positive aspect to stress while we are under pressure and we're nervous, a lot of us thrive under stress, and that results in us succeeding and doing well because we feel like we need to do well. So exactly like we were saying earlier about the 3 stages, where are we on the 3 stages? Are we becoming overwhelmed by our stress, or are we managing it on a level where it's letting us get better? So if you look at this picture over here, it is about the type of things that contribute to our burnout. What are the components of our burnout, and what are the consequences of it? So everybody has different contributions of their burnout. So in this diagram, we speak about work overload, the lack of social support, the lack of control or your autonomy, and your inadequate recognition and rewards. This leads to some components of how we deal with our burnout, which is the exhaustion, our cynicism, and also our lowered self-efficiency. The consequences often of a burnout are our increased physical illnesses, our absentees and not wanting to attend certain things, our decreased commitment to our job, and also our reduced productivity. So going through a burnout and overworking ourselves and stressing ourselves out on top of each other, one after the other, not dealing with it in the bite-sized pieces, is also very detrimental to us. Next, we will speak about our physical effects that are on stress. So the history has shown us that there is a lot of diseases that come into our bodies because of stress. A huge factor, especially research has shown that a big thing is heart diseases. Another thing is hypertension, stomach ulcers, asthma, eczema, and a lot of headaches. So stress definitely does contribute to a lot of our diseases and a lot of our illnesses. And also the rate at which we get better from these illnesses is very decreased when we are stressing a lot. So a lot of studies have been done in hospitals of people recovering from their illnesses and how stress contributes to the rate of recovery. In America, so in the US, heart disease actually accounts for nearly 1/3 of their deaths. There's a lot of problems when it comes to heart diseases all over the world. We know that for a heart disease, there's a strong correlation between people who have a type A behavior or personality. And these are people who have strong competitiveness, they're impatient and time urgency, and they also breed a lot of anger and hostility. So these are the types of personalities that come up to a lot of the heart diseases. They've also contributed to a lot of our behavior. So how we were speaking earlier, how we behave to stress. So when we under stress, does our type A personality and behavior, does it thrive or does it crash? Our emotional reactions can also trigger a lot of our cardiac symptoms. A depressive disorder can also be a very big risk factor when it comes to our heart disease. And a lot of studies show that the risk of CHD is doubled with depression. Stress has shown that, research has shown that stress also has a big impact on your immune response and the way that our body reacts to certain bacteria or funguses, any sort of infection or viral infections. How is our immunity dealing with it? In our body, we have white blood cells. These are called the lymphocytes. So when we decrease these lymphocytes, when we're under stress, our body's reaction to bacteria, viruses, funguses, our immunity is very much decreased. So these are some ways that we can manage stress. These are some healthy ways. You know, a lot of times we do a lot of unhealthy things, but these are some nice ways that we can contribute on managing our stress. So the first topic is called avoiding unnecessary stress. So some things of how we can do that is we can learn how to say no. So setting up boundaries, having limits. What are my limits? What can I do? What can't I do? So I know when I'm at work, if I can only succeed 5 things in the day, I'm not going to set myself up to try and execute and do 10 things. I'm going to learn to say no. Another thing is to avoid people who stress you out. So there's definitely certain people in our life that are going to stress us out. We know exactly who they are, what they're going to say, what they're going to do. And if we're in a situation where we aren't able to deal with more stress, we're going to want to avoid them. Another thing to do is to take control of your environment. So for some people, safety is a big thing that causes a lot of stress in their life. So having control in your environment, having an alarm system, maybe setting up some CCTV cameras. What environments are you placing yourself in that's going to help you alleviate the stress? Another thing to do is avoid hot button topics. You know, there's a lot of topics like religion, politics, and those sort of topics where people become very emotional about them and they stress you out, and having an argument and confrontation about these topics can bring a lot of stress into your life. Lastly, a big thing to do, and this actually kind of feeds into all the different types of techniques of managing stress, is to do a to-do list. What is it that I need to do? Now, we all think a to-do list is just writing down the different things that we have to do, but that actually a lot of time causes a lot more stress, because we have this long list of things that we're looking at maybe every day, and it just seems impossible. So a really nice technique to do when it comes to to-do lists is looking at, what do I need to do today? What do I need to do this week? What do I need to do this month? And maybe what do I need to do this year? Because if something's due in 2 weeks' time or next month that I have to do, why am I adding it on my list of things to do today? And it's important to kind of structure it like that, to not have a million things. Another thing, research shows that when we are ticking off on our to-do list, that is a very subconscious, satisfying thing for us to do. So that's also why a to-do list is very beneficial. The next topic is to alter the situation. So the first thing is to express your feelings instead of bottling them up. So if something or someone is bothering you, you need to communicate your concerns. If you don't voice your feelings, you can often have a lot of resentment, and resentment also leads to stress. Another important thing to do is to be more assertive. So don't take a back seat in your own life. You must deal with your problems head on, and you must also find the best way of anticipating them and preventing them. And lastly, we have to manage our time better. Poor time management can lead to a lot of stress. We have to make sure we find ways of how we can manage our time. We must make sure we don't stretch ourselves too thin. We have to plan ahead, and we have to make sure we know what it is that we're doing. Exactly like we were saying earlier, we want to try and avoid unnecessary stress. So we know if we are late to certain events or meetings or something that stresses us out. So what is it that we need to do? We need to make sure we have a structure, we have a timetable, we have a game plan, we have a nice structured time so that we're able to manage it better. The next thing we need to do is adapt to our stress. How can we adapt to it? So the first thing is to reframe our problem. So we need to try and view our stressful situations from a more positive aspect. How can we reframe it? How can we look at this in a different way? Because a lot of times we have a lot of these problems that are bringing us a lot of stress and upset and frustration, but we're thinking about it in the same way. If we change the way we think about it and we reframe it and we look at it in a different thing, it may bring about new inspiration. It may bring about new ways of dealing with it that could help us alleviate the stress. Another important thing is to look at the big picture. How important is this problem in the long run? Is it going to matter to me tomorrow? Is it going to matter to me next week, next month, in a year? Is it really worth right now getting stressed over? So a huge one is sitting in traffic. That brings about a lot of stress for a lot of us. First off, we spoke about avoiding. So number one, we can avoid sitting in the traffic. We're not going to go at rush hour times. But when it comes to looking at the bigger picture, adapting to the stress, we're in traffic, we're going home. The bigger picture is, I'm going to get home. What is going to happen if I'm a little bit late to getting home? Yes, we want to get home, we're exhausted, we've had a long day, but how can we look at the big picture and adapt to what is happening to us? Lastly, we need to focus at the positive. So stress often brings us down, and how we were seeing earlier, the way that we respond, our emotional response to it is the fear, anxiety, a lot of resentment and all those bad things. How can we look at this in a more positive way? How can we maybe appreciate the things in our life? What are some positive qualities that are happening in our life? So yes, I'm very stressed about work, but I have achieved X, Y, and Z. Yes, I know I'm very stressed about all the assignments I have to do, but what have I actually achieved? And it's trying to focus on a lot of the positive things. The next thing is to make sure that we make time for fun and for relaxation. I think we actually missed the accepting. So first we're going to jump back to accepting. One of the things that we can't change. You know, we all try and control our life and we think we are in control. But a huge thing to do is make sure we understand that we can't control everything. And we have to accept that we can't control every aspect of our life. So rather than stress about it, we have to take a step back and accept. I think a huge thing we discuss when it comes to rehab is you can't control your recovery. You can't be in control. And a big thing in the 12 steps is surrendering. Are we surrendering? Are we surrendering to our higher power? Are we surrendering to the recovery process? Or are we trying to take control? And a lot of times this is very stressful for us. It's very stressful for our loved ones. Another important thing is to look for the upside, similarly to the one before of finding the positive. What's the upside? A huge saying for upside is what doesn't kill me makes me stronger. This is not going to kill me. This is not going to be detrimental. It's only going to make me stronger. I'm only going to grow from it. And like we were saying earlier with the positive stress, when we get through a very stressful situation and we succeed, it brings about a huge boost in our self-esteem, the way we feel about ourselves, because we've actually done something, we've achieved, we've succeeded. And that's a big thing on looking for the upside. Where have I succeeded? Where have I done well? A big thing for accepting is to share your feelings. So to confide in your sponsor, make an appointment with your therapist. You know, again, we can't do this alone. We can't do many things alone. So it's accepting you can't change. We accept that we can't control our stresses. So let me hand it over to someone else, my higher power, my therapist, my counselor, you know, my sponsor. That's why in the 12 steps and in the recovery process and in rehab, there's so many different people that are about sharing feelings. We have groups, we have individuals. There's that space of sharing because you can't do this alone. And you have to accept that you can't control everything. A huge thing about acceptance is forgiveness. So a lot of us have a lot of resentments, a lot of people that we have resentments with and problems that we've had in our life. And if we can't take a step back and accept what we've gone through or what people have done to us, we're going to continuously have resentment. And that's also going to bring about a lot of stress. So if you think about someone who you haven't forgiven, someone in your life that you have a lot of problems with, you are going to become stressed seeing them. You know, going to the shops where maybe you know that they shop, every time you would go to that Woolworths, it brings about stress in your life. So similarly to how we want to avoid the unnecessary stress, if we don't forgive, we're going to constantly be in these stressful situations. The next thing to do is we need to make time for fun and relaxation. We need to set aside relaxation time. A lot of times we're very stressed because we just have so much going on in our lives and we just need a moment to reboot. If we're not rebooting, we're becoming overburdened. We're having that burnout like we were discussing earlier. We're having the little frivolous stresses adding up to a huge, big, major stress, which is not something that we want. We want to deal with the stress when it's actually dealable in the small sections. We want to take breaks. A nice thing for fun and relaxation is connecting with others. When we're spending time with other people who bring about joy and positivity in our life, that also helps alleviate our stress. So if you have a strong support system, for a lot of addicts, a huge thing for connecting is going to a meeting. You know, when we attend a meeting, we are finding people who are in the same boat as us, who are going through the same thing as us, and we're able to connect to them in a positive way. Whereas in the past, a lot of our connections were very bad and very detrimental to ourselves. And the last thing is to try and make sure you do something small that you enjoy every day. Maybe you enjoy, you know, sitting in the garden for 5 minutes, doing some gardening, maybe doing a crossword puzzle, an activity, something that really brings a lot of enjoyment in your life. You should schedule it in your day. It doesn't have to be a big thing. So maybe you really love taking a long hot bath. It's just finding those small things that bring you joy in your day to have that downtime. Lastly, it's to adopt a healthy lifestyle. And I think this actually is the most important one, and majority of us are not really doing. It's, we have to exercise regularly. We have to have a healthy diet. We must reduce our caffeine and sugar intake. And we must make sure we have enough sleep, a nice, good sleep routine and schedule. If our body isn't physiologically rested and healthy and living in a healthy way, it's going to bring about even more stress. And like we were seeing earlier, increased stress lowers our immune system. So if we're not eating nicely and we're pumping ourselves with good vitamins, we're exercising and we're having sleep and we're doing all these healthy lifestyle things, our immune system as is low because of our stress. So it's just going to build onto the lowerness of it. So we went through quite a few techniques of how to manage our stress. There's quite a lot of them. And in every situation in our life, there's going to be a different technique that we use. What works for you may not work for your partner, may not work for your child, may not work for your boss at work. We all kind of adapt differently. That was the behavioral response that we were speaking about earlier. But we have to make sure we do it in a healthy way. And if we look at our loved ones, the way that they dealt with their stress, majority of the time was actually using. So every time they felt stressed, they would use. That would bring about a lot of other feelings of the guilt and the shame and, all those sort of things that we often discuss. But now they need to try figure out a way of how can they actually manage their stress in a healthy way. So when they're in rehab, we do a lot of these sort of techniques and discussing with them of, instead of picking up, what it is that they can do instead. So you as loved ones at home, when, they do come and talk to you, like we were saying in one of the topics, talking to someone or reaching out and asking for help is a big thing. So when they come and ask you for help, you now kind of have a little bit more knowledge on what it is that you can do in order to manage stress. Because I think in society in general, especially, in South Africa, we all live a very stressful life. We're all going under our own different stresses. But it's making sure we find ways that are not detrimental to us so that we can manage them. So that's the end of the presentation. So we will open the questions now. So you can either raise your hand or you can pop a question in the question box and we can see if we're going to answer them. I think actually before we ask questions, maybe we can...
They need treatment. Now I can tell you what is the normal treatment, and I can tell you what is the research treatment. The normal treatment is an antidepressant. It has about a 30% chance of working. The other one is a benzodiazepine, which is really nice and addictive. It works for 2 weeks and then it stops working. Your next one is epileptin, which is the one that I often use. Now, epileptin is non-addictive and it works immediately, and you can use it for a small time and then not. If I say non-addictive, please remember Panadol and Smarties is also addictive. But it doesn't have any physiological reasons to be addictive. And so epileptin is my drug of choice. There's also a couple of other, like Esperide or Pasrin or Stressin. But when they did the research, they have something called a H score. Now, a H score is how good a drug works. And the H score for benzodiazepines is the highest, but only for 2 weeks, and then it stops working. And then the next H score is the epileptin. And then only way down the line comes the SSRIs, the Prozac and the citalopram and the escitalopram that everybody prescribes and all the GPs gives for anxiety. So they're not particularly a good drug. They're not particularly working. Even Zyprexa and olanzapine works better. But the best drug is Neurontin or Lyrica, which is the epileptin or the Lyrica. The difference between the two is that the one works for 6 hours and the other one works for 24 hours. So to get a dosage right, it's often easier to give the short-acting one until you get the right dosage, and then the people can go under high dosage. Or if you use it only when needed, the short-acting one that works for 6 hours is often better. And some patients respond to Lyrica and not to epileptin, or to epileptin and not to Lyrica. In the South African medical aids, they do not see anxiety. In fact, can make it worse. And if you have bipolar, See, I told you she's naughty. If you have bipolar, then it actually, the fluoxetine or the SSRI might make it worse. So for protective reasons, you do not easily use an SSRI in an addict or in an addict's family for that matter, because the chance of getting bipolar, I have a screen thing. Can I screen share? I don't know if I can. I actually made this screen share as a...
I think I've got the right, but let me see if I can. Have you got it? Oh, there we go.
Now, as far as I know, I could see. I actually made this for when I was going to talk to you, but you know me, I can never wait. My husband said I'm really horrible. I do not have the ability to keep a secret. So this is the big thing in addiction. 60%, there's a 60% overlap with these circles. So 60% of people with addiction have bipolar. 60% of bipolars have anxiety. 60% with anxiety have ADHD. So there's this big overlap. So people often say, Tia, everybody is bipolar that you see. But yes, 60% of people with addiction is bipolar. And 60% have anxiety. And 60% have ADHD. And if you don't treat all of that, people don't get better. So this is the circles. And when I speak to you guys in a while, I'll speak to it again. But that's the big thing, is that you have a 60% chance of having bipolar or anxiety when you are an addict. So that's what it is, you know. Anxiety is constant in my patients. I have to treat it. That's why the epileptin gets there. If I forget the epileptin, I have about a 40% chance that the patient won't need the epileptin, but quite often I get the phone call from Cheryl or from the rehab and says, this patient's really anxious. And I'm like, oh, well, I didn't give the epileptin because I was like, I always sit here. Then I double check and triple check. Is the patient really bipolar? Is the patient really anxious? You know, really, isn't that just making the same diagnosis? And literally, I can't make another diagnosis because the overlap is so high. So that's the epileptin, I think, is the best for anxiety, or Nerika. If you have the SSRIs, that's a problem. Yeah, she eats my hair. It's absolutely horrible. I pick out, you have to see, I wake up in the morning with pieces of hair missing. But that's the big thing, is that epileptin and Nerika and anxiety, I think, is a good idea, but that we have to look for the other things as well. By the way, her name is Fire. Isn't that the most beautiful name for a puppy like this? Okay, that's it, Danny.